Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. A 52-year-old African American woman presents to the dermatology department. She has noticed a patch of pigmented skin on her toe, which has been slowly enlarging over the past 5 months. On examination, she has pigmentation of the nail bed of her great toe, affecting the adjacent cuticle and proximal nail fold. Which subtype of melanoma would you expect to present in this manner? A. Superficial spreading melanoma. B. Acral lentiginous melanoma. C. Lentigo maligna melanoma. D. Nodular melanoma. E. Amelanotic melanoma. Here we have a 52-year-old African American woman. The age and the ethnicity of the patients in the presentation and diagnosis of melanoma is important. Here we have 52-year-old African American woman coming to the dermatology with a chief complaint of a patch of pigmented skin on her toe, which has been slowly enlarging over the past 5 months, and the pigment is enlarging over 5 past months, and the growth of the lesion is also important. On examination, she has pigmentation on the nail bed of her great toe, affecting the adjacent cuticle. Involvement of the cuticle and proximal nail fold in melanoma is also important. And the question is asking about the subtype of melanoma. The involvement of fingernails and toenails, and also their sole of the foot is important in acral lentiginous melanoma. The diagnosis here can be acral lentiginous melanoma. Explanation: acral lentiginous melanoma, pigmentation of the nail bed affecting proximal nail fold, suggests melanoma. We call it Hutchinson's sign. Acral lentiginous melanoma is a rare form of melanoma alveolar, but a common form of melanoma in people with darker skin. As we said, in African American patients, it's important because acral lentiginous melanoma is a common form of melanoma in people with darker skin, but in white skin patients is very rare. Hence, it's important to be able to recognize acral lentiginous melanoma mostly affects people with the age of 40 and is equally common in males and females. Is not related to sun exposure. It typically presents as an enlarging discolored skin patch on their palms, fingers, soles, or toes with the characteristic of other flat forms of melanoma. It can arise in the nail unit, appearing as general discoloration or irregular pigmented bands running longitudinally along the nail plate, and is called subungual melanoma when it arises in the matrix. This patient has subungual acral lentiginous melanoma with an important clinical clue of this called Hutchinson's nail sign. This sign is characterized by extension of the nail bed matrix and nail plate pigmentation to the adjacent cuticle and proximal to lateral nail folds. As we can see here, the presentation of the patient's melanoma was like this photo. Here we can see different types of acral lentiginous melanoma in patients' fingernail and toenails. We can see the involvement of cuticle, the involvement of proximal nail fold and nail matrix in acral lentiginous melanoma. And we can see also the involvement of sole in these patients, and their involvement of soles is one of the presentations of melanoma, acral lentiginous melanoma also. Okay, we talked about different type of melanoma, the most common types of melanoma, presentations and the features of melanoma, or different types of melanoma in the management and the management and presentation of different types of melanoma in our YouTube videos. For more information, you can watch them. Thank you for your attention.